How you doing today? My name's Eric, and I'll be in charge of anesthesia for spinal fusions. Anesthesia that we'll be using for this procedure is usually general, and when I talk about general anesthesia, I'm talking about IV and inhaled gases. The reason that we use IVs is because during extensive surgery, where it is desirable for patients to be unconscious with relaxed muscles. Also, some advantages to using IV anesthesia is well controlled with assisted ventilation and also has fewer side effects than other anesthesias. When we're talking about inhaled gases, it's usually used for shorter surgeries with much rapid induction. And the advantages of inhaled gases compared to IVs is that there's little post-operative nausea and vomiting. When I go into the stages of anesthesia, I'm talking about the first stage, which is going to be basically known as the stage of anesthesia. With this, it begins with the administration of anesthetic agent and ends with the patient becomes unconscious. Hearing is amplified usually at the end of this stage. Stage 2 is called the excitement phase, and usually that's because muscles become tense, but swallowing and vomiting reflexes are still present. Breathing may become irregular as the breath may be held, and during this time the environment should be kept as quiet as possible, also known as the quiet time. When we're talking about phase 3, this phase is called the surgical anesthesia state. It begins with the onset of regular breathing again. The patient comes back and does his regular breathing patterns, and vital functions are depressed. The eyes are usually fixed and reflexes are lost or temporarily depressed. The surgical procedure is begun during this stage, so this is mainly the stage that the surgeon comes in and starts doing his thing. When we get to stage 4, this is called the complete respiratory depression, and during this stage, spontaneous respirations are absent. The patient is maintained by the anesthesia machine, which supplies oxygen and a set rate of breaths for the patient. So basically, this basically takes control and helps the patient breathe and have a safe heart rate while the procedure and anesthesia is taking effect.